Kia ora guys, how's it going? I hope that we're coming to you in a nice time during the lockdown. We're going to be asking some questions to Māori Ora today, all sorts of stuff related to student health and well-being. And today I'm asking these questions to Jill Mark, the clinical lead GP at Māori Ora Student Health and Wellbeing at Victoria University of Wellington. Hello, Jill.
Hi, Michael.
How's it going? How have you been?
Yeah, good, thanks. We're good here.
So one of the first things, and probably the most obvious question that a lot of people want to know is student health actually still open and running during the lockdown?
So the answer is absolutely yes. The main difference is, although we have locked our front door here at Kelburn and closed the Pivotia campus, we are providing all our services via the phone initially and restricting the people that we see face-to-face to only the clinically essential and urgent cases. And so we're making those decisions when we're speaking to people on the phone.
So is that how we can book an appointment now? We can just phone you? Or can we just show up, or what happens now?
Yeah, so what needs to happen basically is we're advising not to just turn up. And the reason for that is we're trying to minimize the exposure for students to coronavirus and also for staff to that. So the vast majority of consultations we're able to tie up on the phone without needing to see people face to face. So those people who we are bringing in see face to face, we're advising the students to hang around outside the building basically to minimize their time inside, so that the GP can give them a call when they're ready to see them, ask the final questions, and just basically bring them in for the physical examination part so the student isn't unnecessarily exposed to COVID, and the same goes to the GP.
And so what about things like counselling services, or if I have really poor mental health? Is this still available?
Yeah, so the counselling service have moved off-site, so they're working remotely and doing everything over the phone. They're using Zoom, and that allows them to see students face-to-face remotely, as it were. So they're still running pretty normal services, really. They are having their routine counselling sessions over the phone. If students phone up and need something a bit shorter term and there's availability, they will be slotted in for a phone or video consult. And they've still got the duty counselling from 1 till 4 each day.
So on that note, do you have any specific tips to do with, student mental health? This is a time where, we're spending a lot of time away from friends and family, and it can take a really big toll on people's mental health. So what kind of tips do you have for us?
Do go out for exercise as long as it's close to home in your neighbourhood. Eat healthily, sleep as well as you can. And then there's the 5 ways to well-being. At the risk of sounding cheesy, make sure you're connecting with people in your bubble face-to-face, but also more widely speaking in terms of Facebook and all those other ways of connecting. Do things that are nice for people, take notice of what's going on around you, keep learning and keep active. So the ministry set up a website as well, called the All Right website, which has got lots of access to resources and an app and stuff like that. For anyone to access. It's all free, of course. And there's also the usual 1737 number, and to hike out if people are at a real crisis.
Awesome. Thank you so much for that advice. That's wicked. So per se, someone's on a prescription and it's starting to run out. How do they get a refill? Obviously, you can't really come and physically, a lot of the time, do this stuff now. So how do these kind of refills and stuff work?
The usual process of going onto the website, clicking on the repeat prescription link and ordering them electronically like that. That comes through to our nurses who have a look through the notes and put that request on the prescriptions kind of template that we've got. And the GPs are working through those, and those ones where we would normally say come in and we'll make an appointment to organise that and give you an interim script. We're trying to avoid that situation, which just pushes, makes them have to come in 2 weeks' time. So what we're doing is we're phoning people, having a chat with them, seeing how they're doing, and trying as best possible to give them the longest script that we're allowed to. So we're making more phone calls and taking more time with the scripts because we're aware that students might not be able to get in face to face. And also students might be, they might have gone home to Auckland or whatever. So it may not be even possible for them to come in.
Okay, and, during this time, there's a lot of prescription pills and stuff that have to be continued, especially things like contraceptions like Depo-Vera repeat or an IUD insert. If someone needs something like this, can they still make an appointment during this time?
Yeah, so what we're trying to do at the moment, because of the uncertainty of the levels, we've been putting a hold on the routine stuff and asking people to phone back when it becomes clear what we're doing. So we've had to think quickly about, you know, what that means with all the different services that people potentially come in requesting. So, for example, with the Depo-Provera, that's an injection that requires a nurse or a doctor to administer that face-to-face. So what we are trying to do is ensure that anybody who's on a form of contraception like that has a discussion with their GP about what the options are. And I mean, we're following family planning guidance, which is basically, if there's another option that is suitable for that person that doesn't require them to come in for a face-to-face contact, then we should be offering that to the student. And if that's not appropriate for them for whatever reason, we may be able to continue with the injection. So, I mean, that goes for all sorts of different scenarios, not just contraception, and every individual circumstances are different. So there's not one blanket rule for everybody. Other things important about contraception would be, you mentioned IUDs. So at the moment, we are in general avoiding bringing people in for routine IUDs and offering other alternatives to contraception. Where it comes to emergency contraception, however, we are seeing people for emergency contraception, because I think that you know, there's only so many options for that, and we need to make sure that that's available. So we do have a GP who's able to insert IUDs, for example, in the emergency context.
So on the other side of sex, what about STI tests? Are they still available?
Yeah, so short answer is yes, but it depends what the context is. So basically the lab that we send all our tests to, because they're super busy, obviously, they've limited some of the things that we can request. So, you know, one example would be they don't want us using the swabs that we use for COVID on other less urgent issues down below, shall we say. And what that translates to, kind of practically speaking, is if we think somebody's got a certain infection, you don't necessarily have to test for it. We can just crack on and treat it. So we're doing quite a bit of empiric treatment, so treating based on what you think the problem is before you've got any results. But the things like, you know, I just wanted a routine screen, there's nothing in particular happening for me recently, but I just wanted to be sure, we're not going to be able to do that just now. And it's just because of priorities.
Cool, good to know. Cheers for that. The last one, and I guess this is quite important for a lot of students who have headed off home or ended up not being in Wellington anymore. For those students, you know, they've left Wellington, they're pretty far away from student health. Can they go to their local doctor despite still being enrolled at student health?
Yeah, so this is going to be a tricky area that we're, you know, because we know a lot of people are away. And the reality is you can only be enrolled in one general practice at one time in the country. So students who are currently enrolled here, if they've gone away, use Auckland as another example, they can enroll in a general practice up there if that place is accepting new enrollments. And that is something that I think some places are not accepting new enrollments because they don't know what's going to happen next. There are also, you know, basically we would advise if somebody is in another city at the moment, they should probably phone us first, see if we can meet their, you know, meet their need on the phone. We've got access to all their notes. We know them well. We can prescribe safely based on the notes that we've got. If we think they need an examination and that's going to have a big impact on management, or it's too risky to do things without that, then we would be advising them they do need to seek kind of urgent care wherever they are. So that might be enrolling with a GP. It might be going to a practice and them being agreeable to seeing the student on a casual basis, which costs a bit more admittedly. Or, you know, there's emergency departments and they can have accident and urgent clinics depending on the region that you're in. So we'd probably advise start with us, and if we can't meet your needs for whatever reason, then we'll help you to try and access services wherever you are as best we can.
Okay, and what about, you know, we're coming into winter, worst time of the year for flu, a lot worse because we're also in a pandemic. So what about vaccinations?
Yeah, so vaccinations is something we're really keen to keep moving with here at Student Health. We've identified our kind of higher risk population who are eligible for the free ministry funded flu injection. These are people with chronic diseases, people with asthma on preventer inhalers, that kind of thing, pregnant people also. So we've sent a text to all these people, and we've got flu clinics up and running for that. So that's ongoing, and we're encouraging people to come in for that. So this group of people need to get their flu vaccine, and we're working on that. In terms of the wider population with the flu vaccines for students, this is still a bit of work in progress, to be honest. We don't quite know what's going to happen with the levels, so it very much depends. If we get down to level 2, I imagine we can start kind of business as usual. In terms of other vaccinations, we're doing some and not others. So the ones that we think are most important probably in the student population would be making sure people have at least got their first MMR. And if people are eligible for the free Menactra, plowing ahead with that. Also, even if they're not eligible, I think all students, it would be great if they could be funded, but if someone chooses to pay for the Menactra and the Bexero, which is the meningitis B part, we would like to try and immunise those people. So MMR and meningitis we put as high priority. Other things like travel vaccinations, of course, no one's really traveling right now, so they're on hold, of course. And HPV vaccines as well, they're not so time dependent or clinically urgent, so we've put them on hold for now.
So the last thing, pretty relevant one to ask, is student health testing for COVID-19?
So basically, if somebody phones up, they've got respiratory symptoms that fit the case definition, I'll tell you later where you can find that. And if they're eligible for swabbing, then we will bring them in either to see them inside if they're quite unwell in the isolation room and swab them and examine them appropriately. Or we'll actually swab them outside the side door if they're actually not particularly unwell, but they just need a swab. And we've got a gazebo set up outside the kind of above the dog run area at the ambulance entrance in case it's raining, so people can wait out there. We ask people to approach that sort of area, and like other appointments, the GP will phone them when they get there, get a bit more information to minimise that close contact to protect both students and staff. So yes, we are swabbing people. We're following the Ministry of Health, swabbing kind of priority guidelines that they've set out, and using our clinical judgment as well.
Thank you so much, Jill. Thank you so much for the work that you and the other staff in your field are doing. It's fantastic to see. And yeah, we really applaud you for everything you're doing right now. So thank you so much for that.
You're welcome, and thank you too.